In a heartfelt tribute to the memory of the late Florence Mubonehe, who touched the lives of many, her family, relatives, and numerous well-wishers have come together in a united endeavor. This endeavor takes the form of establishing an extraordinary initiative, the private health center at the shores of Lake Bunyonyi, which also holds the distinction of being the Africa's second deepest lake. Born in Chabahinga village, Kagarama Parish Amhambo Town Council, in the recent established Rwanda district that was formerly part of the larger Kabale district, the late Florence Mubonehe was a dedicated and educated health worker. She began her career at the Bwama Leprosy Hospital in the 1960s together with the missionary doctors, and after a decade of service, she moved on to Kabale Regional Referral Hospital in the 1980s. Her commitment to the healthcare here spanned over 40 years, leaving a significant impact. Florence Mubonehe, who had been serving at Kabale Regional Referral Hospital, unfortunately passed away on February 4, 2016. Despite her untimely dismiss, her dedication to work and service at the hospital left a lasting legacy.
Mubonehe Florence was a nurse who was not educated and she learned from side, serving the community with the doctors, the missionary doctors from Bwama Island. So in that, she tried to serve the community on her level best as a nurse.
Championed by Alice Champile, the eldest child of the late Florence, along with her siblings and other relatives, a Florence Memorial Medical Camp was organized today in Chabahinga village. The response was truly remarkable as the camp attracted a large number of attendees, overwhelming the village with their presence. During this medical camp, more than 500 local residents received a wide array of services, including general medical consultations, screening, dental care, laboratory tests, and various other healthcare offerings.
This morning, we have seen approximately more than 400 people, both females and males, and plus the children. And what is overwhelming is the need for the drugs that have been available. Even up to now, people are still lining up for treatment. And the challenge is that whenever they go to government health facilities, most of these drugs are not available or they cannot access them.
During the event, they unveiled their intention to establish a well-equipped health center dedicated to the memory of the late Florence Mubonehe. Dr. Foeb Atkunda, the first child of Florence Mubonehe, emphasized that this health center would prioritize effective maternal services.
Bringing antenatal services closer to the people, especially in this community, will be of great help. They will not have to go to Bwama or to Kabale town to access these services. Even then, they can't afford the transport. So this memorial center will address that problem.
She highlighted the significant detail that their mother Florence had given birth to their firstborn, Alice Champile, while en route to Kabale Hospital using the lake.
At one time, she told us a story of how she gave birth in the middle of the lake, and she was in a canoe alone when she was giving birth to her first daughter, that is Alice. So Alice thought that it would be of great help to the people, especially the pregnant mothers, so that they don't have to first cross the lake to get the maternal service.
Dr. Nicholas Masco, the son of the late Florence, shared that they're diligently working towards the commencement of the services at the facility. He also mentioned their plans to acquire both an ambulance boat and a vehicle to effectively respond to the emergencies in the region, with an aim to provide timely assistance and medical care to the community.
So our future plan is to have medical staff on site, have the medical equipment on site, to have everything on site which we can use to take care of the community. The next with a referral system of having the boat ambulance, the car ambulance to the regional referrals. That's our dream for now.
Once established, the center will become the third facility serving the Bunyonyi community alongside Bwama Health Center 4 and Kagarama Health Center 2. These existing centers are located at a considerable distance from the Chabahinga. Dr. Solomon Mubonehe emphasized that the establishment of this new facility would directly address the challenges associated with patients having to travel long distances for medical care. Additionally, it will contribute to the improved adherence of medication by making healthcare more accessible to the local population.
I can imagine the distance they have to travel, and now they're getting their services nearby. So, for example, the pregnant women whom we've seen, they will not need to cross the lake. If in case there is labor starting, they will visit the health center, which is very good. And the problem that we've talked about, poor adherence to medication, it should be easy for patients to be seen at the health center. This one. So in memory of Auntie Florence, the late, I'm very grateful that they have started this health center here.
Margaret McClellan, a supporter to the proposed facility, expressed that her motivation to contribute to the fundraising for this project was ignited by reading a book authored by the late Florence's daughter. She underlined the importance of extending help to the local community and emphasized the ongoing need for additional assistance.
Has written a book called This Girl Did, and it describes the conditions that she grew up in, and it also describes how her mother had to walk many, many miles to give birth in very difficult situations. And that need from that generation is still here today. And I feel personally, and I know many others feel, that if we can help in any way to bring the facilities needed, we will.
Local residents in the area have shared that they often have to cover substantial distances to access medical treatment. They revealed that the financial constraints frequently lead them to forego necessary medication when they are unable to afford it. This highlights the pressing need for improved healthcare accessibility and affordability within the community.
turaba tutazine ushanga urarabanisibwamo wazayo kandi uragigendamo ngezi tawe uragigendamo no kushutama ubwo karengwa kuzayo twabona ubuyambi bwa hano turaba twabona ubuyambi bwa hiyi muno
ine irwariro Kagarama Health Center 2 kakuruga kunu kuzayo umuhanda ni murengo munonga ma transport irakira kubateganisa irindi riribwama Health Center siribwama biri muri Kitumba nago kuzayo kirateganisirwa no kugenda mu byacu bya engine transporter byo kutwarika kugarura tubinise.
The residents also responded positively to the medical camp, expressing their anticipation for the benefits that the future health facility will bring. They believe that once the health facility is established, it will significantly aid in improving the access to necessary medical treatment and medication. This endeavor not only serves as a tribute to Florence Mubonehe's enduring legacy, but it also represents a symbol of hope and dedicated care for the immediate local community and beyond. Norbert Ngamachi for Chiges Television.